Introduce our guest speaker, Carol Brooks. I'm absolutely delighted to have Carol join us today. And so without further ado, I'm going to hand over to Carol to kick off. Thanks so much, Carol.
Brilliant. Thank you. Thank you very much for having me. It's a real pleasure because my passion, if you like, is being able to spread the message about evidence-informed practice and evidence-inspired practice. So recognising that, you know, that we have, through safeguarding pressures and a whole range of other evidence out there, a lot of information to help us in the work that we're doing with children and families. But being able to think about how we share that and share that with people like yourselves is amazing. So thank you, Sharon, for inviting me and for having me here. Moving on in terms of what the research is, let's tell you a little bit about it. So safeguarding pressures, I'm sure there were some people on this session who have read it. Thank you for reading it. But it is unique. It's done by the Association of the Directors of Children's Services, conducted by them. I'm the lead researcher, so I'm a director of Carol Brooks Associates. I've been working independently as an independent specialist. I'm still trying to work out an independent specialist in what, but as I'm a specialist, I've been told, for, as Sharon says, many years. So I started doing this in 2010, and it was a historic look back to 2017, and it pulls together, it's unique in pulling together different qualitative and quantitative information. Those keywords are really hard. So basically it's numbers and narrative about across children's early help and social care services. But what we also do is we look at the context that sits in terms of the communities and the socio-economic and the wider determinants that children and families live in. And we look at the past, what's happened in the past, what's happening now, and what's the future context, and what might the direction of travel for children's services be. So we're looking to say, this is what's happened, this is happening now, and what we think might happen in the future. Most importantly, we try to get underneath of why, because if you want to improve children's services in terms of the practice, the operational aspect and the leadership, we need to know that why. So it very much is an evidence base for the sector. We also look at the policy and legislative context, massive at the moment, as we're going to cover a little bit later, and hopefully the 30-minute group work that your discussions that you're going to have will also look at the influence and the impact of your local policy, but also the national legislative context, very apt at the moment, because let's face it, we are facing a massive change in terms of COVID. I've lost count of the number of regulations and changes that have come out of the government about what we're going to do. You know, are we bubbling, aren't we bubbling in September in schools? The education catch up, 1.4 billion across the whole country for tutors. How are they going to do that? So there's a whole raft of legislation that we need to get and factors that we need to get our heads around. And the part of that is also looking at why children are in receipt of children's services and how we are, as corporate parents for children looked after, you know, how we are actually undertaking those functions. So as I say, ADCS commissioned me. There's a core to do this, 12 years of data. There's a core purpose every year, which is how has safeguarding children's services changed? And each phase there's a specific area of focus relevant to that phase. So 2015, we did a supplementary report on unaccompanied asylum seeking children. And we were not just looking at in terms of the, you know, the numbers, how many, but we were looking at the needs and the experiences of unaccompanied children, UASC, and basically how local authorities are managing that. We also did some sort of like, again, we've had a focus way back when Michael Gove was the Secretary of State in terms of adoption. And this particular phase 7 research that's published in February, we looked at the pressures faced by local authorities to September 2020, so it's very current, and obviously looking at it with a COVID lens. So what has happened since March, April 2020 up to September, and what were directors of children's services saying what might happen next and what we need to be prepared for. I think I can say, I know some of you are writing, which is brilliant. I think, Sharon, we can send the slides out. They'll be on the web, in the live recording anyway, but I'm happy for the slides to go out to you as well. And anything else that you fancy. So if there's any links or anything you need, just chuck it in the chat. Happy to, and I'll try and pick up stuff on the chat as well. So this slide that you've been looking at for a long time, you might even have had a chance to read it by the time I've been gabbling on. It shows the website page. So if you want to know the detail and go into what ADCS safeguarding pressures is in more detail, the evidence it provides, all 7 phases going back to 2010 are there. So we've got, you'll see there's 12 years worth of trend data about what has changed. Not just in the data, but what has changed in how children's services are operating, what the challenges are and what the enablers are. And the response from local authorities, so, you know, big up to yourselves and your colleagues in your local authorities. And we have a response from 129 local authorities this year, which covers nearly 90% of the child population. So that is one of the biggest non-statutory research projects in the country, which is, I think, is brilliant. The fact that directors actually sign up to this and want to do it, and that there is value in it, I think is great. I do want to throw a bit of a sense check in here, because again, you will all be exactly the same in the roles you're doing. One of my soapboxes, for want of a better word, is, so what do children and young people say? What are they thinking? What are they feeling? What are their lived experiences? And this research does not include that on purpose, which feels a little bit counterintuitive. But this research provides a state of the nation to children's services. It is a hard and a system strategic view. And it purposely doesn't include the views of children. It's not trying to capture their lived experience. It is that director's strategic view, if you like, it's that balcony view, that helicopter view of how are we operating as children's services. But we all need to reflect on the relevance of this to the information of our own local areas. And, you know, and I guess think, what does this mean for the lived experience of children and families in my area? What would they see or feel or say about some of the evidence that we're providing? So I'm going to talk a little bit more about some of the factors. And again, it's thinking about what's life like and what's the lived experience for children and families, given those factors and the evidence that we have found. And what would they say we need to do better, or what they say working well. So moving on to how this research relates to yourself. IRO lens is unique. Sharon and I considered some key ways in which this research may provide a think piece, which is what I think it is really for your roles. And again, there's time to talk about these in groups later on this morning. When we're talking about an IRO, I know that the independent reviewing officers, there's some of the roles are children looked after, some of them are children looked after and child protection chairs, some of them are both. And it might be that you are here with another job role. So what I do is just say, in terms of try and think about what your unique position is in being able to be part of the solutions, and think about how we can use, say evidence-based practice, how you can use this going forward in your role. So what is your unique role? Your caseloads, your position as reviewers and scrutineers. You have a more strategic view in the higher caseloads you hold. Sort of more children that and families that you're working with. In your scrutiny review role, in terms of driving best practice, in terms of grasping the need services outcome that you're seeing in plans, and how these are relevant, how much they're being met, and what works and what doesn't work. There's also a wealth of information about the practice you'll have. As I say, what's working for individual children, or that collective basis across all the children and families that you are working with. So you've actually got a really good evidence base, a lot of information, a lot of real intelligence that can feed into commissioning, and we're going to cover that a little bit more later. But thinking about how do you, if you are seeing placements, if you're seeing services that are really making a difference for children and young people, if you're seeing long waiting lists for some services, if you are seeing that some interventions, some programs, some services are not working, How are you feeding that information up to commissioners and to feed into strategy and to feed into how we make it better for children and families? So that the intelligence that you have, not intelligence in terms of the evidence that you're gathering on a daily basis, is fantastic. About understanding the efficacy of provision, understanding what needs there are that may not have services that can meet them, and then what we do about it. The other thing that is really important, I think, in terms of your role is your role as change agents. So how you understand, interpret and support implementation of new policy, changes, expectations, and that could be local or national. Also in terms of models of practice. So I'm sure many of you will have experienced changes in models of practice. Sometimes it might be multiple models of practice in your local authority, be it signs of safety, family safeguarding, restorative practice, yada, yada, yada. So in terms of your role in change agents, in understanding how those are being understood, implemented, and the impact of them on the children and families as you are reviewing is also a unique role for you, I think. The other thing to say about this is I know obviously in terms of dispute resolution is a way in which many of you will be using to move things on for children and families, and to be able to work with team managers. Those, that working collaboratively, working restoratively obviously is really important, but really being able to think about your role in being able to support and understand the implementation of different models of practice, different legislation, different policy, etc. And that sometimes the hard, it is difficult. It is difficult. That transition from old to new is difficult. There'll be a transition phase in the middle. So again, what you might see in the children and families you're working with, if there is new legislation or new policy, you might see that there is a little bit of the old way of working and a little bit of the new way of working until it actually embeds, and that's okay. I don't know, we seem to be fixated in the public sector in, well, we're going to finish this on the 31st of March and we'll start the new one on the 1st of April. Whether it is an IT system, your client record management system like Liquid Logic or Mosaic, whether it is a new form, whether it is a new policy, whether it's a new MASH or hub or integrated working, especially as we come to sort of like the integrated services and integration with health. We cannot finish something on 31st of March and start fresh as a daisy, getting it right on the 1st of April. So being able to think about forms, policy, systems, legislation, how you have that overview, that balcony view that's looking down on how you can support managers in understanding their efficacy or not, and implementing those is a really good role for you. It might sound as if I'm saying, these are extra things to do, but you'll be doing this anyway. This I'm sure you're all doing this anyway. We're not asking, it's not something new. It is like I say, it's a bit of a think piece and a reflection point for you. The other thing I think in terms of this point about understanding and supporting implementation is about anxiety and how you've got the ability to support managers and practitioners' anxiety about implementing. And it could be, again, thinking about you're anxious yourself, think about the care review. It has been so long in coming. We've had the interim report from Josh McAllister, and now we're thinking, well, we don't know what's going to happen. Does it mean, I mean, those of you who are as old as I will remember the Orange Book, and you're thinking, all that time ago. And what was the other one? That's sort of like the, ICS, the Integrated Children's System. You get all these changes, and you're thinking, oh my God, we're never going to be able to do this. This is, and the anxiety is real. And being able to, in your roles as scrutineers, reviewers, having that real focus on what difference we're making for children and young people, gives you the chance in understanding policy, legislation, and the impact on plans and outcomes for children and young people. And really, in terms of that anxiety, getting to grips with it and being able to help people to understand, how well are we doing in implementing it, and allowing some slack, I guess, if it's not implemented perfectly on the 1st of April. I use those dates, you know, it could be any time, but you get what I mean. So, you know, again, I think in terms of just picking up this point, again, it's thinking about what, in terms of the impact of policy change on children and families. It's thinking about, can you see the impact? So thinking about models of practice, thinking about different ways of working. So one of the things in safeguarding pressures we picked up was very much about the growth and the investment in early help. So again, it's thinking about your role in being able to look at actually, you know, what has the impact of early help, for example, been in terms of staying safe, staying put for you know, one of the pieces of legislation we've had in terms of care leavers. So really being able to think about, can you see the impact of changes to policy and legislation in your work with children and families? Has it done what it was intended to do and had that positive impact? And then it's obviously thinking in terms of your roles, how you, oh sorry, I flipped through my slides too big, how you can bring that to the attention of your managers, of commissioners, of leaders, and where are the forums within your local authorities to have those discussions about the evidence that you are finding and how that can inform sort of like commissioning, understanding services that there are, understanding the impact of policy, etc., those things I just talked about. So you're important people, basically, and you have a really critical role to play in the evidence base that informs in children's services. And I'm sure there are many more facets to IRO's lens that, you know, you're doing it without recognising it. And we're going to come back, and I think one of the questions, Sharon, in the breakout rooms is about your role and how you see that. So let's look at some of the findings now. Let's go into the detail of what the research actually said. So this demand, and hopefully you can see big enough that graph on the right hand side. So this shows demand across key activity. So I'll go into the graph in a moment, but what it does, the evidence says, is that demand continues to increase at a greater rate than population growth. So we know there are more children across the country. It varies across the country. The growth in the northeast of the country is slowing down. The growth in other parts of the country is growing enormously, especially in London. So what we are seeing is we know there's going to be more children in social care, early help, schools, wherever it happens to be, because we've got more children, full stop. So demand is increasing because we've got more children, but it is increasing at a faster rate than that population growth, and it is likely to do so. The population projections tell us that there's going to be, you know, that population increase in some areas is going to continue, and one of the conclusions of this, the evidence was that growth is going to, in demand. So we're talking here about early help, referrals to children's social care. That's on the graph, that's the green line. Section 47s, that's the purple line. Children in need, that's the bluey line in the middle. Children subject to child protection plans, the orange line. Children looked after, which is the dotted line. And initial contacts, that's the pinky line at the top. We know, and we are predicting, and directors of children's services were predicting, that generally this is going to grow, and this is going to continue growing unless the underlying factors that cause children and families to come to the attention of children's social care are addressed, and I'm going to cover those in another slide in a moment. So looking at that chart, you can see that there has been an increase since 2007 when we first started collecting the data. That you can see there's been an increase in all activity except children in need. The pink line, initial contacts, massive increase in initial contacts. And if you do look at the report, the very back page, you've got a summary. I can't remember the number off the top of my head, but it's something like 198% or something increase in initial contacts over that period. The reason for that, and this is really important in terms of looking at why, part of the reason for that massive increase in initial contacts is, in the old days, it was referral to children's social care, full stop. But now, with the integration of early help and children's services into MASHs, into joint hubs, initial contacts, that number now includes some that were early help, other complex safeguarding teams. So there's more that is involved in those initial contacts now. It's not an initial contact to children's social care, it's an initial contact to children's services in a lot of authorities. However, the striking thing that has not changed in terms of definition or process is Section 47s. So a massive increase over that period in Section 47s. But the increase in children subject to a child protection plan has not increased at the same rate. Now, one of the comments down the left-hand side says that the England averages masks a much more diverse picture, including regional variances, and the variation between local authorities and regions is more pronounced than previously. So some of your local authorities, you will have seen a decrease in child protection plans in terms of children looked after, partly because of the models of practice that you have been using. So think about the DFE innovation projects, think about family safeguarding, work partners and practice are doing, no wrong door. So there are models that this research and obviously the evaluation of those projects has shown where we can physically see the reduction in numbers of children, the demand in the system partly because of those new models of practice. Yeah. But it is specific to individual local authorities, and there will be other factors that are probably influencing that reduction as well. So if you've got any queries, just chuck it in the chat, and I'll try and pick some of them up. I think that's the best way of dealing with any queries at the moment. If I've got time at the end, we'll have some queries as well, questions as well. So the other thing on top of this, so obviously you guys will be dealing with the increase in demand in terms of the increase in child protection. Some of you will have seen a decrease, but what is really important to remember is outside of children's social care and early help, the demand for children's services generally in terms of special education needs and disabilities is also increased, to the extent that when you ask a director of children's services what you're most worried about, it used to be, I'm most worried about safeguarding and children's social care and the large number of children looked after, child protection plans, etc. Now, more and more of them are saying, I'm really worried about SEND. It's broken. That's the whole process, the whole system is broken because of the legislation, because of policy. I think we've got 3/4 roughly of local authorities have got a written statement of action for SEND. So again, that's part of the context in looking at children's services and what directors are dealing with. Excuse me. So thinking about findings and the policy and system factors. We know that some of the new legislation is great for children and young people. Absolutely, no one could deny the positivity for young people of staying put, for example. However, there are examples, and they were, we picked them up in the research. There are examples where national policy has not improved outcomes for children and families. It's added to the financial resource burden, or it's actually made more noise in the system. So there is more in the report if you want to know which, but I'll just read a couple of examples of those that were picked up here. Again, recognising that we are talking about all England here. 152 local authorities may have different experiences. So part of what I think is really exciting about times like today is being able to, I wouldn't say compare, but to discuss how are we different from other local authorities? What is my experience? What's your experience compared to other local areas? So what you've got here, I'm just going to read it if that's okay, just to give you a flavour. So you've got the interpretation application, keeping up to date. Sorry, excuse me, reframing practice based on the range of coronavirus regulations and restrictions. Some local authorities had used the freedoms that were given for COVID. Some had said, no, we're not using them. We're doing what we always did because that's safe practice. Talked about already the delay in launching the children's social care review, potential recommendations and change that there might be there. Increase in attention to contextual safeguarding activity. So we know this is a massive issue, and we know that there are again, thinking about the work that Carleen Firmin, that Research in Practice at the University of Bedfordshire are doing. I know in Greater Manchester they're actually looking at a data set and better data around contextual safeguarding. It's likely a consequence of national policy initiatives and a drive to do better on contextual safeguarding approaches, but there is also likely to be more prevalent. So there's this thing about, are we seeing more and are we understanding more because it's on everybody's minds and it is there at the forefront? And is it that some of that was there before, but now we've got this spotlight on it? Refugee asylum seeker legislation, policy funding, including the voluntary status of the National Transfer Scheme. So again, I know the Home Office, there's been a change of leaders at the Home Office, and they are trying very hard to work with ADCS on that. I saw in the July edition of Children and Young People Now that Matt Dunkley's really, this is a technical term, having a go at the government around the National Transfer Scheme not being mandatory. We know from this research, and the figures are in there, about it is very disparate about how many local authorities are accepting transfer of UASC, how many are having their own issues like Portsmouth in terms of the number that are coming in there. So again, policy, legislation, and this you will all be seeing in the work that you are doing with these unaccompanied asylum seeking children. Then we've got the implication for children's services of the expected change to the deprivation of liberty of safeguardings, delay in the passage of the domestic abuse bill, NHS policy to drive the number of children in Tier 4 mental health placements, mean that actually those children are being referred for secure welfare placements because there aren't Tier 4 beds and we haven't got secure welfare placements anyway, and the impact of the public law outline, public law working group about best practice in child protection and family justice systems. I've just seen what the time is, so I'm going to speed up a little bit, Sharon, so don't, if you need to give me a nod, sort of like, let me know, but I will speed up a little bit. So the pretty grid on the right here is just a tiny bit of the timeline created to map all the events. So what we did is we looked back to 2007. This is just like a tiny excerpt of it, and we mapped what is all the events, the policy and legislation, the inspection frameworks, the financial changes, and how that impacts on children's services. So on this slide, you've got links to some of them that are on the website that are zoomable. And again, thinking about the massive changes, and the colours mean different things. So red is child protection, the amber colour is, I think that was looked after children. How easy it is to keep abreast of all the proposed and actual changes in policy and legislation. And I think a reflection point for yourselves is what is reasonable for you to understand and about the changes in legislation and policy. And how is your leadership team helping you, managers and practitioners, to understand the implementation and in terms of the practice of this. Findings in terms of parental factors and neglect. The evidence through this research robustly identifies multiple negative impacts of long-standing economic and social equity. More children are living in families where wider social economic determinants, welfare reforms, poor housing, poverty, domestic abuse, mental health, drug and alcohol abuse, they have created additional strains on parenting capacity, exacerbated by COVID. And I'm sure I'm not saying anything there that you don't already know. But what we have in terms of some of the evidence in here, looking at the housing data, we see that actually there are changes in housing from one community to another. So families being placed in local authorities that are, especially in terms of around London or areas where there is expensive or not a lot of housing, we're seeing a massive increase in temporary accommodation, in eviction, and that all contributes to the living conditions for children that may not be ideal, but also isolation as they're placed outside of their authority. So strikingly, 25,000 families, I can't go through this presentation without at least giving you some statistics, 40% of families in temporary accommodation were accommodated outside of their borough in the first 3 months of 2020. So massive, so there's an increase in those that actually they're not being housed in your authority, then your families are not being housed in your authority, they're being housed in another authority. So again, thinking about that, the receiving authorities' response in terms of that. Sometimes they're placed without notification, especially if they're below social care, you don't need to notify. So just really quickly on here as well, we know neglect increase, and again thinking about in-work poverty, families that I call it that just need a little bit of support. It might not be neglect, and it's that differentiation between sort of like early help and early help, and when it actually becomes intentional neglect, or neglect where it's abuse, or neglect it's abuse, and how we're dealing with that, and the increased complexity and presenting issues. Other findings: the efficacy of commissioning. Expenditure on children's services has been increasing due to increased costs, especially for placements. The increased number of children that are coming into care, there's fewer children leaving care, and also in some areas they've seen a reduction in foster carers as a result of COVID, as they're making different life choices. Responding authorities calculate 1.9% budget deficit. So authorities across England, we calculated, need another 800 odd million pounds just to break even, just to fund what they need to fund. We've seen additional investment in some authorities, especially sort of like that investment by the council, backing by the council, by members, by chief execs, and directors have been tenacious in maintaining improvement programmes. We know that there is a massive problem with placements. Children's Commissioner in November last year had to put a publication out about residential placements, and the market is clearly dysfunctional. Increasing cost, variable quality, and again, it's thinking about your role in IROs, about what are you seeing, what are you feeling, what is your critical analysis about the placements, and how, about the quality of them, about the consistency. And in terms of actually how are you feeding that information into the placement sufficiency strategy, etc. There was also, in terms of the increase in care leavers, so being able to think about how we're going to meet the placements for care leavers as well, and in terms of as increasing costs. Increasing looked after children looked after means increasing care leavers, and how we're planning for those. So Sharon, I don't know if you want to say anything about the understanding family need, demand, supply, etc. Move on.
Yeah, thanks very much, Carol. So, I mean, I was thinking that the ADCS safeguarding pressures research really has robustly shown how data collection and analysis can be used really intelligently to better understand family need. So, the demand, for want of a better word, on services, and also service response. So, supply. So the population of older children with complex emotional and behavioural needs has increased significantly, as we know. And for children needing therapeutic residential care, for example, the safeguarding, care and cost pressures can be significant for local authorities. So concerted collective efforts have, the potential to help address the mismatch, I guess, in supply and demand, so that children's needs are better met. So to address the issues based on value, so if we could give more of a consideration to the value of care as well as the cost of care, and find a way of demonstrating that through some of the the forums that we work within and alongside. So ROs, as Carol has rightly been saying, are uniquely placed to show the value of children's care. So our insights could support commissioning arrangements and help to reshape the market. Not a term I like, but a term that's often used. So I guess one of the things that we might consider is how or could data be captured from child in care reviews to enable ROs to provide a measure of the quality and the value of each child and young person's care arrangement, so that the links to identified outcomes for each child as part of the RO's role in progress, chasing and overseeing a child's care plan in the pursuit of, permanence, so that they achieve that security, that stable, loving, care for that we want to see for every child is absolutely secured. So when we break out into breakout groups, later on, one or two of the groups will be, looking at that very issue. But I think it's an issue that we've certainly looked at nationally, in terms of the regional leads periodically, and I think it's an area that we could have further conversations about and thinking space about going forward. Thanks, Carol.
Brilliant, thank you. And again, recognising that, as I said, in terms of the insights that you have, and sort of breakout groups that we have in a moment, being able to start those discussions, but recognising that NIROMP is in a really good place to be able to continue some of these these discussions as well. So thank you. Okay, so the next, I've got two more slides, and then we're going to the rooms. This slide, you may not be able to read it. What I would urge you to do is, if you're interested, have a little look in the accompanying narrative to this. And I'm just going to draw your attention very quickly to the red bit down the side. So again, thinking about how we categorise the factors that impact on the lives of children and families that mean they need support from children's services. So you've got social factors, which is the changes to the underlying needs faced by the local community, parents, as we've already heard. And then you've got system and practice factors, which is the way the system, that's us, and the CCG and the police and schools, how the system of services respond to the needs of children and families. So that's us being efficient, being effective, and being, getting it spot on in terms of what we're delivering to meet those needs. So they are the factors that we can influence some of, not all of them. And we've split it in terms, and then you've got the infrastructure in terms of, sort of like funding, basically. And some of the things down there. So again, I'm not going to read what's in it and get very much time of it, but what I think is really important for yourselves is looking at, again, in the red bit across the top, there are 3 parts to this. And those of you that have used the problem tree, I know there's a version of it from Monroe, but I use the problem tree quite a lot, but I've renamed it the analysis tree because it's not a problem, it's something we're analysing. But if you look at the causes and drivers of each of these, so what is it? What is it that is making this happen? What is it that is causing those presenting needs that we are seeing? So sometimes what we do, we try to address the presenting needs without addressing the causes and drivers. So we try to address neglect, for example. We try to address sort of like the housing issues without looking at what is causing those housing issues, be it practice, be it policy, be it something specific in that family. And then we look at the effects that causes. So again, this is something that I know a lot of the local authorities I work with find it really useful, and keeping that focus on the child. So presenting needs, what is actually driving that? What are the families doing? What's the policy, etc.? What's happening that causes those presenting needs? And then very much thinking about what is the impact on that? What is the effect on children, on each individual child? So that's just I think a nice way of showing that. Final slide, just really thinking challenges and considerations. One size does not fit all. We know that more children are experiencing mental health. That we know there are older children coming to the attention of early help and social care, massive rise in 16, 17-year-olds that are becoming subject to child protection plans, looked after. Not just because of the Southwark judgment, because of family breakdown, other reasons as well. Challenges about the long-term impact of COVID-19. And we heard directors saying there's actually latent need there, that we know it's there, but it's not manifesting itself yet. And then thinking about another challenge about horizon scanning, what might happen next. So being able to, directors were less certain this time, than 2 years ago about we really don't know what's going to happen next. Anything could happen next. Only half of them said this might happen. So just really thinking about The last thing about what happens next, ADCS message remains strong. We must now turn our attention to how collectively across central government departments, schools and local communities and IROs, we can mobilise rapid wraparound support for children and families to thrive, not just survive. Now is time for the government and local authorities to invest in children, drawing together at a national level and local level the disparate policy initiatives, pots of funding for unconnected policy intentions into one substantial, coherent whole. That way we can make the country, this a country that works for all children. So I hope that's been useful, a very short summary. Like I said, if you've got the group work breakout rooms now,